Hey everyone, Dr. Jereme Trunk with Balance Within Integrative Physical Therapy and Myofascial Release. I wanted to show you today a couple exercises that can help make a large difference in a number of areas of your body. Specifically today I wanted to talk more so about the pecs, okay? Pecs can play a large role in a number of issues including neck pain, shoulder pain, and even back pain. We oftentimes can see either in our peers, our coworkers, our family members, or even in ourselves that positioning where our shoulders start to get pulled forward. And pecs is one of the biggest players of that system. So to get into that area, I'm going to show you a couple of basic exercises which can help greatly with that. So first one is going to be a positional stretch. So we're actually going to use the doorway. And with the doorway, what you want to do is you want to have one foot in front of the other. Does not matter which foot. This is actually a very key thing because if you keep both feet in back, you're going to be kind of falling into your arms. We want this to be very nice and controlled. So you're going to have one foot in front of the other. The most basic setup is to have the elbows around shoulder height. Keep your back straight and lean in forward till you feel a gentle pull on your chest or even into the shoulders. Now with this, if this hurts at this certain height, you can always bring the arms down, or even if you wanted to, if you just felt like it was much tighter, and oftentimes you will find that once you get the arms up higher, you will feel more of a stretch into that system. Once you're there, once you have a comfortable or tolerable position, I'm going to recommend that you hold things longer, and that's for a 2 to 5 minute period range, okay? We have a separate video about that which you can check out as to why we recommend that. However though, because you're going to be holding things longer to make these longer lasting changes into your tissue, what you want to do is make sure it's a very tolerable stretch, okay? If you're in a position that's very intense and you're holding it for around 30 seconds and you feel like you can barely hold it beyond that, you do need to ease up, okay? But in regards to that, if you do feel like you do need a quick stretch to the system, you can still hold a very tolerable stretch around 30 seconds. That will help take some of the tension out of the system. It's just that talking about making greater changes to the tissue, 2 to 5 minutes minimum is the number we're going to be going for. For people who actually do have some issues with shoulder pain, one of the things I might recommend is that if you can't tolerate that positioning, is that you either use a myofascial ball. If you don't have one of those, you can have 2 tennis balls around your house. You can either tape them together or put them in a sock, but what you can do is go up to the doorway, and we're using either one, so I'm going to use the tennis balls just because most people probably have tennis balls around the house. Is you're going to put that there, and you're going to gently roll into that tissue in the chest area here, okay? Oftentimes along that line straight down from the shoulder at about a 45-degree angle towards your midline, you will find usually the tightest spots within that range. But once you're there, you're going to find a knot or a rope, and it's going to feel like a tolerable tenderness or maybe even it hurts good. And then once you're on that spot, I'm still going to give the same recommendation of either a 2 to 5 minutes gentle hold, or if you just need a quick release, 30 seconds of kind of just massaging it will help take some of the tension out of it. It's just that for longer lasting changes, you hold the release longer. Hey guys, I hope you found that information useful in that video. Try it out for a week or two and see what it does for you. If it helps your neck or shoulder pain, great. Otherwise, if not, there's oftentimes multiple pieces to the puzzle as to what your body may have going on. But if you're interested to see what the integrative physical therapy approach can do for your body and putting those pieces back together, visit us at balancewithinpt.com or follow us on Facebook. Till then, guys, be well.